When I think about healthcare policy in the state of Colorado, the first thing that comes to mind is access. Access and affordability. Access should be, if you need to have care, that could be behavioral health or physical health, you should be able to access the care that you need. I believe that healthcare is not a privilege, that it's a right, and you should have access to it, and it should be affordable. When I say affordability, it should be at a level where people can afford. So if you have some medication that is like $500 for 3 or 4 pills, and the person is on a fixed income, they're a senior, they're isolated, there should be some kind of pay structure that's in place to deal with the people who are not as fortunate or who are not privileged to be able to still access the care that they need, even though they don't have the resources. I believe in the common good, and the common good means that we have to focus on the people who don't have the resources to maintain their health because of costs. When I think about behavioral health, I think about our youth. I believe in the state of Colorado, our youth are exposed to far too much violence. Our school situations are dealing with the shortage of teachers. We need to increase staffing in our schools to make sure that we have access to school nurses and counselors and physical activity. We need to make sure that those learning environments are producing healthy minds for our young people to take their places in the future tomorrow. But resources and funding is critical. And I think that every child has a right to learn and to have a fresh start and a safe start. And we need to fund that if we think that's a value. So my concern is about youth behavioral health. It's also about the pipeline of workers as relates to healthcare. We don't have enough nurses, doctors, physical therapists, counselors, the list go on and on and on. We need to make sure that we're training people to take these roles, but also we need to protect them. And by protecting them, we need to ensure that teachers and nurses and doctors and people working at the drive-in or place aren't exposed to violence just based on people's rudeness. I'm not quite how sure we get there, but it shouldn't be just so casual that people have a right to be rude and to harm somebody just for doing their job. So I'd like to address workplace violence.